welcome to NTV, and again it's a very good morning here. It's a Friday, and when you talk about health, you know, for everything that is moving in the country, you're supposed to be healthy, you're supposed to be having a healthy body, and as well also very many health issues that are supposed to be tackled, and each and every day everyone strives to have a healthy body and also have a healthy life. So today we're talking about health, but it's another aspect, and today it's 65 years of celebration. It's the Uganda reproductive health. And these people deal in certain things when it comes to family planning and the like. So, you know, the 65 years journey, many times people talk about family planning, but hey, do people actually appreciate this journey? The Uganda that we had 65 years ago and the Uganda today, does it really reflect the journey that we've gone through? So today we're going to be talking about health and reproductive health. And as I've told you, they're celebrating 65 years here. We're going to talk to Madame Chalimpa, who is the programs director at Reproductive Health Uganda, and she's going to be explaining to us what they do and also the key challenges that they've been having with this 65 years, the journey that they've walked. Yes, a very good morning. Good morning to you. Yes, you can see the burning is already here and all is set. Tell us briefly about Reproductive Health Uganda.
Thank you very much. Reproductive Health Uganda is one of the oldest NGOs in the country. We've been in the country for over 65 years now, providing sexual and reproductive health services. We pioneered family planning in 1957, and we've been at it for all this time. We expanded our program from vertical family planning to sexual and reproductive health services, and we cover the entire country through our 18 facilities. Yeah.
Okay, now when someone talks about reproductive health, you know, the first thing that comes in their minds, maybe someone might think about family planning, use of condoms and the likes. How far does reproductive health go away from these other initial things that people actually know?
Yeah, we are an all-round organization that provides advocacy for sexual and reproductive health. We run and operate 18 clinics around the country. We engage with young people. As you all know, we are a young population, so our programs focus and target young people across the country. We do reproductive health services targeting men and women, looking at cervical cancer screening, prostate cancer screening, and we do quite a lot for in and out of school young people. Okay,
someone would like to know the status of reproductive health in the country, because I understand you've been traversing different parts of the country and also finding out different things. What's the status now?
Yeah, we continue to expand our program throughout the country, working and partnering with district local governments, working with like-minded organizations, and also working with the cultural institutions throughout the country.
Yes, talking about the cultural institutions, because I understand one of the key challenges when it comes to reproductive health are the rigidities when it comes to to culture. How have you been able to break down and to make some cultural leaders understand and appreciate these services?
Yeah, we use facts to inform our programming. And what does this mean? For example, we are faced with teenage pregnancy during the COVID period. Yeah, it was a reality that we are all faced with as a country. So those are the kind of facts that we put on table, and cultural leaders deliberate and come up with actions within their respective areas.
Now, many times away from the cultural rigidities, we've also seen when it comes to gender, the men actually think they're so predominant and the likes, and when it comes to reproductive health, sometimes you find some men actually pushing it to the women. How have you tried to also make the men understand and appreciate that they also must take part in this?
Yeah, we have men engagement interventions, one of them being the I Decide Men game, that helps men to appreciate their role in providing sexual and reproductive health services. One, we target men as users of services. We also target men as partners to women, but also men as leaders. So that means that we have deliberate interventions that helps men to appreciate their role, their critical role at the center of sexual and reproductive health. And what does this mean? That men will appreciate that they need to escort their partners for antenatal care, for example. They need to prevent unwanted pregnancies by use of condoms, but also helping the young boys to appreciate their role in preventing gender-based violence at all levels.
Okay, now also talking about the adolescents, it's that kind of stage that is so active, and also most especially our sisters and also the boys. Have you taken this to the schools to also ask for the adolescents to also appreciate the reproductive health, or is it still too early to make these people understand, most especially the teenagers?
We reach out to young people in two different ways. We categorize young people in two categories. The young adolescents, the 10 to 14, that we talk to about growth and development, that we talk to about body changes, but also telling them how to prevent early sexual activity and related behaviors. Now we have the active young people, 15 to 19. Those are likely to have a teenage pregnancy. So we talk to them about preventing teenage pregnancies, use of condom, delaying sexual activity, use of contraceptives for those who are active. Yes.
For the learners in schools?
15 to 19, those are women in the communities.
15?
Yes. Haven't you heard of mothers who are 15, 17, and 18?
Isn't that a time bomb?
No. Yes, that's why we have a young population.
It's because someone might actually think that you're exposing them to something that is not yet ready for them.
No, it's just the reality in the country. And I think when we talk about child marriages in the country, those are the children we are talking about. They are 17 and having 2 children. Go to the hospitals, you actually find them, and you realize that the country is actually sitting on a time bomb that we all need to address collectively. Yeah.
Okay, maybe what are some of the key challenges that you face as we wrap this up?
Yeah, the challenges are quite many. One of them being poverty. Poverty is a key underlying factor, and it influences sexual and reproductive health, access to sexual and reproductive health services. The second is having a very young population that is not employed, and therefore even when they need services, it becomes hard for them to access these services. The third is about the culture and traditional beliefs that of course influence access to services. We live in a patriarchal society where men still make the decisions, even for the women when they need to take services. So it means that when the men don't support their partners, it becomes very hard to access these services.
Okay, thank you very much. Well, also we've just witnessed the arrival of the State Minister for Health, that's Victoria Rocky, and she's also going to be in attendance here. Maybe we get a word or two from her as we wait for the celebrations here. A very good morning, Honorable Minister.
Good morning to you.
Yeah, I'm very good. Yes, we see you here for Reproductive Health Uganda, and as government, these are partners that you're having, because again, it's a mandate for government to have a healthy population. But again, if you have partners like this, what does it mean to have partners that are actually also trying to help government fulfill its mandate?
Okay, I'm so grateful for this organization because it's really strong supplementing the efforts of government to have a healthy community, concentrating on every category of community. There's a package for the youths, a package for women, and above all, the world is facing increased population, so birth control is given great attention, and actually this organization started as a family planning unit. So as government, it gives us great effort. As Minister of Health, although they are not here, I know they are also proud of this organization, and a lot has been done. There are so many centers all over the country, so it's a spread effort. And as government, as a minister, as the chairperson, I'll continue praising and lobbying for government to get more serious with health issues.
Okay.
Thank you.
Thank you very much, Minister. Well, that's it from me. That's just a brief as the Reproductive Health Uganda. They're celebrating 65 years of existence. What a journey, starting from as a family planning structure up to a structure that is actually going on and disseminating different services to the population of Uganda. Back to you in studio, in for my man, Mbide Stephen, who is down but not yet out on FFC. Back to you in studio.